some just simple strategies maybe that can help us achieve those fitness or health goals, whatever it may be, that you maybe have seen in some of your patients?
Right. Now, here at our clinic, the majority of our patients come in and they want to obtain better health, which they articulate. And what we do is we remind them that just wanting to get better health without a plan is just a hope, a
Right.
dream. So what we do is we help them put together a strategic plan. And what we do is we use what's called the SMART goals concept, which is an acronym I learned about first many years ago when I graduated high school and went to the military before college. The S is for being specific. The M is for making sure your goal is measurable. The A is for making sure it's something that's achievable. The R is for making sure it's relevant. And then the T is for time bound. So let's hypothetically say a person wants better health. So the SMART goal concept would include them having it be specific, saying you want to lose 10 pounds in 10 weeks. And the way you want to do it is you want to make it measurable. The metric you're going to use is you want to walk 30 minutes, 3 days a week for 10 weeks. You want to make sure it's achievable. If a patient that was, say, 60 or 70 years old said, I want to run a marathon, then that's not very achievable for that person that's never run before. Walking is better because you want to make sure it's something you can actually do. You want to make sure it's relevant. You want to ask yourself, why do I want to do it? We want to talk about the why. We want to discuss the fact that if they accomplish this goal, then they'll have better control of their diabetes, their blood pressure, and live longer and avoid having that heart attack or stroke that they might have. That makes it more achievable. And then we want it time bound. By having deadlines, it makes it so that we're more likely to stick to it and be more consistent every day.
Right. And do you find yourself maybe reminding your patients that if they aren't able to achieve those goals, like you said, maybe shoot for a smaller goal or something that's more attainable, or even if they don't have someone to keep them accountable at all? Are you willing to do that for your patients?
I do. As a matter of fact, I serve as their accountability coach, where every week, a lot of my patients that are in our program, they'll send me an email that journals what they're doing. They'll say, okay, 4 days this week I did the 30-minute walk. Or they'll even write down food diaries and share them. And then the other thing is when they come in, we share their weight. We look at how much weight they lost, and then we look at something called hemoglobin A1C if they have diabetes. Now it's better controlled. And these metrics with the positive feedback encourage them, and then you wouldn't believe how motivated people can be.
Well,